Hi, I'm Professor Dave Beebe in the Department of Biomedical Engineering, and I'm going to talk to you today about global health. And it's an issue that I think a lot of engineers don't know a lot about. It's something I've become involved with over the last few years. So what I'd like to do in the next 10 minutes is give you a brief overview. I'd like to first sort of give you a snapshot of some statistics of what the health of the world really is and how it compares with the health that we're used to in the United States. Give you some idea about why there are these disparities in health. Also then talk about the considerations as an engineer if you're going to think about designing an instrument or a diagnostic tool for somewhere besides the United States, the developing world, for example. There are certain considerations that one needs to consider. And then I'll conclude with a couple of examples that I think will highlight some of the maybe surprising issues that you haven't thought about before. So the first thing I like to start with is to educate you about what are the causes of death in the world, and you might be surprised that they're very different. So in the developed world, places like, in general, we can consider the developed world, for sake of argument, as sort of the United States, North America, and Europe as being the developed industrialized world. And the leading causes of death in the industrialized world, number one is heart disease, number two is high blood pressure. Not far down the list are things like cancer. Traffic accidents are actually on the top 10 as well. So you're familiar with those sorts of diseases. But in the developing world, so places like Africa specifically is actually the continent I'm going to focus on, but it also includes certain portions of Asia and South America. The number one cause of death in the developing world is HIV/AIDS. And number two is lower respiratory infections, things like pneumonia. And the other parts of the top 10 are things like malaria and tuberculosis. So diseases that we are pretty much ignore in the United States. We don't have to deal with them on a day-to-day basis, yet that's the main cause of death in the rest of the world. Just a sort of illustrative example, the statistics, these are just a stereotypical baby girl born in various places. So in sub-Saharan Africa, their chances of, their risk of death before the age of 15 is 22%. So 1 in 5 girls born in sub-Saharan Africa die by the time they're 15 years old. In China, that's about 5%, and in the United States, it's less than 1%. So just to give you a scale, it's truly sort of a horrific state in some parts of the world. So with that as background, I'd like to focus a little bit specifically on HIV/AIDS because it's something that I actually am involved in some projects trying to develop diagnostics for the developing world for HIV/AIDS. And so just a few more statistics. So the prevalence rate of HIV/AIDS in South Africa is 18%. So again, about 1 in 5 people in the country of South Africa have HIV/AIDS. In a place like Kenya, which has taken, and I'll talk a little bit more about this, which has taken a much more proactive approach to prevention, they are down to about 7% now. And in the United States, it's less than 1%. Interestingly, if you look at, so there are drug treatments available for HIV/AIDS, antiretroviral treatments. If you look at the coverage rate, so for every 100 people that you've identified as having HIV/AIDS, how many of them are actually getting treatment? In South Africa, 28%. So 20% are infected, only a third of those are getting treatment. In Kenya, about 40% are getting treatment. In the United States, essentially 100%. If you have it, you get treatment. Number of deaths, if we look just at absolute numbers, in South Africa, 350,000 people per year. So the entire population of Madison plus 100,000 die each year in South Africa due to AIDS. Kenya is about 100,000. The United States is 22,000. Keep in mind that the population of the United States is an order of magnitude higher than any of these others, and we're an order of magnitude lower in deaths. So it's a huge problem. And I actually had the opportunity to visit Cape Town, visit some of the shanty towns around Cape Town about a year ago, and it's really an amazing thing to see. Both the hope and inspiration of the people there actually trying to fight this disease, but also just the overwhelming impact that it's having on them. So the next question is sort of why? Why is this a big problem? And why is there such disparity between the prevalence and deaths in the developing world compared to the developed world? So in some sense, sort of a short answer is that in the developing world, people don't live long enough to get things like cancer. And it's just true. Most cancers are a disease of the aging, and it's therefore a disease of affluent societies because you just don't live long enough. But the root causes really are things like, so why don't they live long enough, right? So there's limited, or in some cases no, access to health care at all. There's a lack of education. I'll give some examples of this, how even leaders of countries are completely ignorant of the true causes of disease, for example, and putting misinformation out there. There's cultural aspects, so cultures, even from country to country in Africa, for example, the cultures are very different. It's why you see some countries in Africa actually being proactive and doing a fairly good job of trying to combat the disease, and others not. And politics is a big problem as well. So there are a number of factors. I'm going to focus a little bit on HIV/AIDS because it's what I know most about, and there are some factors that lead to this. So there are societal factors. One of the big societal factors is gender inequality. Another big societal factor is discrimination against those that have the disease. And those are actually very still prevalent. And again, it has to do with leadership a lot. So those are some factors. There's also a lot of factors that are outside the control of the individual. Things like lack of knowledge. It goes to this education. So there's a lot of in a lot of these countries, there's just a lack of information and actually propagation of misinformation about the disease. Just a couple examples. I'm going to talk briefly about South Africa and Uganda because they're two different countries that have handled the situation very differently. And it's actually timely. So we're making this video in October of 2008, and just 2 weeks ago, there was a change in the South African government, a new health minister, and the new one, her name is Barbara Hogan. And for the first time, she made a statement that has never been made in the last 10 years in South Africa by the government, and that is that, quote, "We know that HIV causes AIDS." So for the last 10 years, the South African officials had denied the link between HIV and AIDS, and even recommended very unconventional treatments like beetroot-eating herbs as a way to solve HIV/AIDS. So it's not so surprising that South Africa has one of the biggest problems when you have the leaders of the country actively promoting falsehoods about the disease. Uganda is a country that, also in Africa, where actually the rates of HIV infection have dropped over the last 10 years, from about 15% down to about 5% now. And it's been largely attributed to good leadership, where the president of the country in the early 90s came out publicly and said, this is a big problem, we have to deal with this. They set up a very grassroots organization so that so that there was not a stigma attached to the disease, and actually those that were infected actually became active participants in educating others. And so that's a really great success story that has really, without a whole lot of cost necessarily, they've really gone a long ways towards controlling the disease. So those are a couple sort of background on that might open your eyes a bit to the rest of the world and some of the health problems in it. But now as engineers, what can we do about it, right? So most of the engineering solutions that have been done in the world ever really have very little impact on health in the developing world. And it's because we as engineers typically are designing devices and instruments and software for our market, for the developed world market. So let's talk for a minute about what the market's like in the developing world, and what are some of the technical considerations that one has to take into account when you're thinking about designing a solution for these problems. So one of the big ones is infrastructure. So you can't assume that you're going to have refrigeration, for example. You can't assume that you're going to have reliable electricity. You have to assume that it's going to go out once a day for an hour, right? There are very few trained technical staff, so you can't assume that you can't give that in that environment. You can't have a complex instrument that requires a lot of steps and training. It's not going to work. You can't make a service call, right? So if it breaks down, there's not going to probably be any spare parts, that sort of thing. No field service, and limited funding. Although for particular diseases like HIV/AIDS, there is quite a bit of money now available through nonprofit organizations to help with these sorts of things. But still, it's designing an instrument for that sort of environment is very different than today. So last, I'd like to go through a couple of examples to show you how people can sort of do it right or do it wrong as an engineer to engineer solutions. And one simple problem is, which I didn't talk about, is water. So it leads to a lot of the infectious diseases transmitted through impure water and that sort of thing. So how do you purify water? Well, if you don't have electricity, you can't do it the traditional ways that we would here with UV light or boiling. It's not trivial to do. So the problem was no reliable electricity, no heat to boil the water. So A group came up with a very simple solution. In sub-Saharan Africa, it's very hot. You get a lot of sunshine, so why not use the sun? And in fact, the problem then is how do you very simply tell the person that needs the water when the water is pure, i.e. when has it reached a temperature high enough that you know that the impurities have been killed. So you might think of using, you know, some fancy electronics with a thermometer and a digital readout, right? But that requires a battery, and then the battery will die, or a little solar power. But so some people came up with a much simpler solution to that, and essentially they just have a plastic bottle that if you sit it in the sun, it will reach a high enough temperature. But how do you know when it's reached that temperature? They just have a little wax vial, so a little essentially piece of wax inside the bottle in a separate container. When that wax melts, it's a wax that's been formulated to melt at a temperature only when you had a temperature in time sufficient to kill any impurities in the water. So a very simple solution which is being used now. The other example I want to give is one that's actually, that is an example of sort of how not to do it. So there's a great need for, well, so in the developing world, about 4 million infants die every year within a month of birth. And about 1 million of those are due to heat or water loss, so lack of good incubators, good incubation. So there's a group actually at an unnamed university, not Wisconsin, a group of students that set about to solve this problem. So they actually developed a very nice low-cost incubator made out of a clothes basket and some plastic and some very simple electronics and things. And they were all excited, and they took it over to Africa. And I forget actually which country this was, but they took it over and they went to a clinic, and they saw that there were all these actually commercially available incubators stacked in the corner, which goes to a point I mentioned earlier. There's no field service or no parts, so once they stopped working, they couldn't get them working again. But then what they said, and they said, well, why aren't you using all these incubators? And they said, well, we have a better solution, and it's actually something that's been around a long, long time, and in certain cultures this is widespread, and it's called kangaroo mother care. And all it means is if you take a newborn baby and you put it against the chest of the mother and wrap a cloth around it, that the skin-skin contact, the mother's body will actually regulate the infant's temperature much more precisely than any incubator will. So it's an example where you very much need to do the market research. You need to understand the environment you're moving into and make sure that that you're designing for the constraints of that environment. And in some cases, they may have a better solution. In fact, now what's happening is kangaroo care is actually becoming used in the developed world because, in fact, you have a higher success rate with that approach. So hopefully I've given you a bit of a sense for the enormity of the disparity of health in the world, and that we live in we're very fortunate to live in a place where we have wonderful health care. And it's very complex, so it's easy to sit as an engineer and say, well, I'm really good technically, I'm going to solve all these problems, but that may not actually solve the real problem. So one really needs to take a very holistic and comprehensive approach to developing technologies for the developing world, and you really need to go and learn about the culture and the politics so that you understand whether it's really technology that's going to solve the problem. And in some cases, there is definitely technology needed. In other cases, technology is probably not going to help. And there are other ways to help. So I think it's an area that's really growing, and I think many of you will probably go on to work in this field because it's a rapidly growing field, and there's a lot of opportunities in nonprofits and companies even getting involved in trying to address these needs. So with that, I'll close, and thank you for your attention.